Good day everyone, I am Ranina Luzong, your student nurse from Our Lady of Fatima University. Today, I will be demonstrating the proper application of hot and cold compress, including the indication, contraindication, assessment before and after the procedure, monitoring during application, and the rationale. So let's start. So first, I will wash my hands or do the hand hygiene. This prevents the spread of microorganisms. So assume that I already wearing my gloves. Next, I will gather all the necessary equipment to save times and avoid unnecessary interaction. So since I already gather all the necessary equipment, I will now proceed to the next procedure. So I will identify the patient using two identifiers and explain the procedure and obtain consent. This ensures patient safety, reduce anxiety, and gains cooperation. So, good day ma'am. I am Ranina Luzong, your student nurse from Our Lady of Fatima University. For verification po, may I check your wristband and may I know your birthday and name?
Gian Tesha Arbanglo, October 2, 2001.
Okay, thank you. So, today I will be putting a cold compress. This will help you to reduce the pain and inflammation or swelling po. May I proceed na po ba?
Yes.
Okay. So, to provide the privacy of the patient, I will now close the curtains and the door. So, ma'am, are you comfortable with your position po?
Yes.
Okay. So, before that, I will assess the patient skin color, skin temperature, presence of swelling, pain level, open wounds, circulation, sensation, and this determines if the patient is safe for heat or cold therapy and to establish baseline findings. Okay, so the cold compress indication. Cold compress is used for acute injury, swelling, bruising, fever, pain, and inflammation. So the contraindication, do not use cold compress if the patient has poor circulation called hypersensitivity, numbness or impaired sensation, open wounds unless ordered. So, next, I will do the cold compress or I will put the cold compress to the patient now. So, I will just expose the thigh of the patient. So, this promotes privacy or the patient comfortability. Okay, ma'am, ilalagay ko na po. Okay, so just let the cold compress until 15 to 20 minutes. So assume it is done. So, ma'am, do you feel any pain po ba? Okay. Next, after putting the cold compress, ensure that the patient is comfortably in their position. So, ma'am, are you comfortable with your position po?
Yes.
Okay, so that's the end of the procedure in cold compress. Okay, so next is the hot compress. For indication, hot compress is used for muscle pain, muscle spasms, joint stiffness, chronic pain to increase blood circulation. So these are the contraindication for hot compress. Do not use heat if the patient has active bleeding, acute injury, decreased sensation, poor circulation, inflamed or infected area unless prescribed. Okay, so assume this is a hot compress. Now I will put to the patient. Like what I do in the cold compress, I will now just expose the patient thigh and then put the hot compress for at least 15 to 20 minutes. So assume that 15 minutes and 15 to 20 minutes are done. I will now remove it. Okay, so ma'am, are you comfortable with your position? Nakaramdam po ba kayo ng pain habang nakalagay po ang hot compress?
No.
Okay. So that's the end of the cold and hot compress procedure.